Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Oncology Settings in Discourse Analysis. Interactive Assistant Oncology Settings refer to medical environments where cancer diagnosis, treatment, and care take place, involving interactions between healthcare providers, patients, and families. In discourse analysis, these settings provide a rich context for examining how language is used to communicate complex medical information, manage emotions, navigate decision-making, and address sensitive issues related to cancer care. Discourse analysis in oncology focuses on the ways in which language shapes patient-provider interactions, constructs narratives of illness and treatment, and reflects power dynamics and emotional support. Oncology settings are often marked by the need for clear, compassionate communication about serious health conditions, treatment options, prognoses, and quality of life concerns. By analyzing the language used in oncology consultations, treatment discussions, and patient support conversations, discourse analysts can uncover how healthcare professionals balance technical explanations with emotional support, how patients express their concerns and preferences, and how families are included in the decision-making process. Key features of discourse in oncology settings. 1. Communication of prognosis. One of the most sensitive areas of communication in oncology settings is the discussion of prognosis, including the likely course of the disease and survival expectations. Discourse analysis explores how doctors communicate difficult prognostic information while managing patients' emotional responses and providing hope or realism. Example: a doctor might say, "We are looking at months rather than years, but there are treatments that can help you maintain a good quality of life during this time," balancing honesty with reassurance. Discourse analysis would examine how this language conveys the gravity of the situation while providing a sense of agency for the patient. 2. Framing treatment options. In oncology, treatment options often involve complex choices between different therapies, such as surgery, chemotherapy, radiation, or palliative care. Discourse analysis investigates how language is used to present these options and how the risks, benefits, and potential outcomes are framed. Example: a doctor might frame chemotherapy as a way to shrink the tumor and give us more time to assess other options, emphasizing the temporary nature of the treatment while maintaining hope. Discourse analysis would explore how this framing influences the patient's perception of the treatment and their decision-making process. 3. Managing uncertainty. Oncology often involves a great deal of uncertainty, particularly when it comes to how a patient will respond to treatment or how long they will live. Discourse analysis examines how healthcare providers use language to manage this uncertainty, providing information while acknowledging the limits of medical knowledge. Example: a healthcare provider might say, "There's no way to predict exactly how your body will respond to the treatment, but we will monitor your progress closely and adjust as needed," balancing transparency with a proactive approach. Discourse analysis would explore how this language navigates uncertainty while fostering trust and maintaining patient engagement. 4. Patient autonomy and shared decision-making. In oncology settings, patient autonomy is critical, as patients are often involved in making decisions about their treatment plans. Discourse analysis looks at how healthcare providers encourage patient participation in decisions, ensuring that patients feel empowered while being guided by expert advice. Example: a doctor might say, "This is your decision, but based on my experience, I recommend this course of action because it has the best outcomes for patients in your situation," balancing expert authority with respect for patient autonomy. Discourse analysis would investigate how language fosters shared decision-making by positioning the patient as an active participant in their care. 5. Emotional support and compassionate communication. Oncology settings are emotionally charged, as patients face life-altering diagnoses and treatments. Discourse analysis explores how healthcare providers use emotional support language to comfort patients, address fears, and provide a compassionate space for difficult conversations. Example: a nurse might say, "I know this is overwhelming, and it's okay to feel scared." We're here to support you every step of the way, offering validation and reassurance. Discourse analysis would examine how language is used to provide emotional support, acknowledging the patient's feelings while fostering trust and connection. 6. Cultural sensitivity and diversity in care. Cancer care in oncology settings often involves patients from diverse cultural backgrounds with different beliefs about illness, treatment, and death. Discourse analysis examines how language reflects cultural sensitivity, ensuring that care is aligned with the patient's values and beliefs. Example: a healthcare provider might ask, "Are there any cultural or spiritual practices you would like us to consider in your care?" showing respect for the patient's beliefs. Discourse analysis would explore how this language opens space for the patient to express their cultural needs, ensuring that their identity and values are incorporated into the care plan. 7. Use of medical jargon and simplification. Oncology involves the use of complex medical jargon, which can create barriers to understanding for patients and families. Discourse analysis looks at how healthcare professionals simplify medical terms to make them accessible to patients while ensuring that the information remains accurate and informative. Example: a doctor might explain a procedure by saying, "We're going to perform a biopsy, which means we'll take a small sample of tissue to see if the cancer has spread," simplifying technical language without losing essential meaning. Discourse analysis would explore how this language bridges the gap between medical expertise and patient comprehension. Methods for analyzing discourse in oncology settings. 1. Critical discourse analysis, CDA. Critical discourse analysis, CDA, examines the power dynamics in oncology settings, focusing on how medical authority is exercised in conversations and how patients navigate these dynamics. CDA explores how language reflects broader institutional norms and how it either reinforces or challenges traditional hierarchies between doctors, patients, and families. Example: a CDA of oncology consultations might explore how doctors use language to assert authority, such as by controlling the flow of conversation or making certain recommendations appear non-negotiable. The analysis would examine how this affects the patient's ability to express their preferences or concerns. 2. Frame analysis. Frame analysis investigates how treatment options and prognoses are framed in oncology discussions, revealing underlying values and assumptions. This method helps to uncover how certain outcomes are prioritized or downplayed in conversations. Example: a frame analysis of chemotherapy discussions might reveal that doctors frequently frame it as buying time rather than as a cure, shaping the patient's expectations about its effectiveness. The analysis would explore how this framing impacts the patient's decision-making and emotional response to treatment. 3. Conversation analysis. Conversation analysis looks at the structure of interactions in oncology settings, focusing on how participants take turns speaking, ask questions, and provide responses. This method helps to uncover how communication is structured and how power dynamics unfold in real-time interactions. Example: a conversation analysis of doctor-patient interactions in oncology might examine how doctors respond to patients' questions, identifying whether they provide open-ended explanations or shut down further discussion. The analysis would reveal how conversational structures support or limit patient engagement. 4. Narrative analysis. Narrative analysis focuses on the stories patients, families, and healthcare providers tell about cancer, treatment, and survival. This method examines how these narratives construct meaning, influence decision-making, and reflect cultural or personal values. Example: a patient might describe their cancer journey as a battle that they are determined to fight, while another might frame it as accepting the natural course of life. Narrative analysis would explore how these different narratives shape patients' attitudes toward treatment and how they make sense of their experiences. Examples of discourse in oncology settings. Example 1. Discussing a cancer diagnosis. In oncology consultations, doctors must deliver difficult news about a cancer diagnosis. A doctor might say, "The biopsy confirms that the lump is malignant, which means it is cancerous," using language that explains the medical reality while allowing space for emotional processing. Discourse analysis would explore how this language balances medical precision with empathy, shaping how the patient receives and processes the diagnosis. Example 2. Patient-doctor conversations about treatment side effects. When discussing treatment side effects, a doctor might say, You may experience fatigue and nausea, but we have medications to help manage these symptoms, framing side effects as manageable. Discourse analysis would examine how this language reassures the patient while preparing them for potential challenges, shaping their expectations about treatment. Example 3. Family involvement in oncology care. In family meetings, a healthcare provider might say, "It's important that we all understand what's happening so that we can make the best decisions together," emphasizing a shared approach to decision-making. Discourse analysis would investigate how language fosters collaboration between the patient, family, and healthcare team, ensuring that all voices are heard. Example 4. Palliative care discussions. When discussing palliative care, a doctor might say, "Our goal is to ensure that you are comfortable and can enjoy the time you have with your family," framing palliative care as a focus on quality of life. Discourse analysis would explore how this language shifts the conversation from curative treatments to comfort-focused care, managing the emotional and practical aspects of end-of-life decisions. Example 5. Navigating uncertainty in treatment outcomes. A healthcare provider might say, "We can't predict exactly how you will respond to this treatment, but we'll be monitoring closely and adjusting as needed," acknowledging uncertainty while providing a plan for ongoing care. Discourse analysis would examine how this language balances realism with hope, allowing the patient to feel supported despite the unpredictability of the situation. Challenges in analyzing discourse in oncology settings. 1. Emotional sensitivity. Oncology settings are emotionally charged, making it difficult to analyze how participants manage emotions through language. Discourse analysts must navigate the complexities of how emotions like fear, hope, and grief are expressed and how language provides or limits emotional support. 2. Medical expertise and power dynamics. There are inherent power imbalances between healthcare providers and patients, given the doctor's expertise and control over treatment options. Discourse analysts must carefully examine how language reinforces or challenges these power dynamics, especially when patients' preferences may conflict with medical recommendations. 3. Cultural differences in understanding cancer. Cultural beliefs about cancer, treatment, and death can vary widely, making it challenging to analyze how language reflects different cultural perspectives. Discourse analysts must be sensitive to how cultural contexts shape the way patients, families, and healthcare providers communicate and make decisions. Conclusion. Discourse analysis in oncology settings provides valuable insights into how language shapes patient-provider interactions, navigates complex emotions, and facilitates decision-making in cancer care. By examining the framing of treatment options, the communication of prognosis, and the use of compassionate language, discourse analysis reveals how healthcare professionals balance medical expertise with patient autonomy and emotional support. Understanding the role of discourse in oncology settings is essential for improving communication, fostering patient-centered care, and ensuring that patients and families are empowered in their treatment journeys. Frequently asked questions. What does discourse analysis in oncology settings involve? Discourse analysis in oncology settings focuses on how language shapes communication between healthcare providers, patients, and families in the context of cancer care. It examines the presentation of medical information, emotional support, decision-making processes, and power dynamics. Why is discourse analysis significant in oncology? This analysis is crucial because it helps uncover how language affects patient experiences, decision-making, and trust in medical professionals. It also highlights the balance between technical explanations and compassionate communication, ensuring patient-centered care. How do doctors communicate prognosis in oncology settings? Doctors use carefully chosen language to convey prognosis, often balancing honesty with hope. Phrases like, "We are looking at months rather than years, but we have treatments to help you maintain a good quality of life," offer clear information while fostering a sense of agency. What role does language play in framing treatment options? Language can shape how treatment choices are perceived. For example, describing chemotherapy as a way to manage the disease and buy more time emphasizes a temporary solution rather than a cure, affecting patient expectations and decision-making. How is patient autonomy addressed through discourse? Discourse analysis shows how doctors can encourage patient participation by using phrases such as, "The decision is yours. I'm here to provide guidance." This type of language respects patient autonomy while positioning the doctor as a supportive advisor. How is emotional support conveyed in oncology discourse? Healthcare providers often use empathetic language, like, "I know this is overwhelming, and we're here to support you every step of the way," to validate patient emotions and foster trust. Discourse analysis examines how such language helps manage fear and anxiety. What are some challenges in communicating complex medical information? Oncology involves complicated medical jargon that can be difficult for patients to understand. Discourse analysis looks at how doctors simplify terms, like explaining a biopsy as taking a small tissue sample, to ensure comprehension while maintaining accuracy. How do cultural beliefs impact oncology communication? Cultural beliefs can influence how patients and families interpret information and make decisions. Discourse analysis explores how healthcare providers use culturally sensitive language, such as asking about relevant spiritual practices, to align care with patients' values. What methods are used to analyze discourse in oncology? Critical discourse analysis, CDA, examines power relations and authority in medical interactions. Frame analysis investigates how treatment and prognosis are framed, affecting perception. Conversation analysis looks at interaction structures like turn-taking and interruptions. Narrative analysis analyzes the stories told by patients and providers to construct meaning. Can discourse analysis help improve oncology care? Yes. Understanding how language shapes patient experiences can lead to better communication practices, ensuring that patients feel informed, supported, and involved in their care. This insight can foster trust and enhance the overall quality of oncology care.